While we continue to see encouraging trends statewide, the number of cases, hospitalizations, ICU stays, and deaths remain too high.
Too high, almost 2 months into crisis standards of care, and things are starting to get a bit better, but as you heard, still too high. Statewide, we've seen 5 straight weeks of a decline in the number of positive COVID cases from a high of just over 17% in early September. Now we're down to about 12%. Still well above the 5 that we're looking for. Hospitalizations, total cases also declining, albeit slowly, except in one part of the state.
While the statewide numbers are too high but improving, the numbers are too high and not improving in North Idaho. A testing positivity rate that is nearly double the state average, with some counties exceeding 25% positivity. The number of new COVID cases in the Panhandle is increasing, with 22% of statewide new cases last week reported among residents of the Panhandle, and the number of hospitalizations in the Panhandle increased by 3% last week.
Okay, so keep in mind the Panhandle, which includes areas like Coeur d'Alene, it's about 14% of the overall Idaho population. So what is going on up north? The day North Idaho implemented crisis standards of care, a full week before the rest of the state, there were 130 people in those North Idaho hospitals. The last time the data was reported, which was on September 22nd, there were 140 people in the hospital. So we're still not getting all updated information. But this is a look at vaccination rates by public health districts. The Panhandle, made up of Benawah, Bonner, Boundary, Kootenai, and Shoshone counties, currently the lowest vaccinated health district in the entire state, sitting at about 48%. By the way, Shoshone County in the Panhandle has had the highest positivity rate last week, nearly 30%, which means almost 1 in every 3 COVID tests came back positive last week. Again, cases, hospitalizations, positivity rates declining in the rest of the state, but it's still too soon, or I should say, is it too soon to talk about when we can leave this crisis standards of care?
Is that Idaho will be able to exit crisis standards of care when the surge of patients being driven by COVID-19 no longer exceeds the healthcare resources available.
So that's really kind of up in the air and not really well defined. It means a few things still have to happen. We no longer need non-traditional or non-medical spaces that would care for patients. Smaller hospitals can then transfer their critical care patients to larger hospitals, and some non-elective surgeries can continue. All of those things need to happen. So likely not anytime soon, but again, at least in most of the state, we're kind of on our way there.